Gäste, sehr geehrte zugeschalteten Anwender und Mitglieder der Gesellschaft. Im Namen von DePuy Synthes Deutschland, Wirbelsäule, nenne ich Sie recht herzlich willkommen für dieses digitale Symposium. Wir haben heute die Ehre und den Privileg, mit Herrn Professor Dr. Heiko Koller einen Anwender zu Gast und als führenden Arzt bei uns zu haben, der uns schildern wird, wie ein neues Stab-Schraubensystem die posterioren und cervikalen OPs verbessern kann. Dargestellt an unserem Produkt Symphony. Ich wünsche Ihnen viel Spaß, würde hoffen, dass wir nach den 20 Minuten aufgezeichnetem Vortrag auf jeden Fall sehr viele interessante Fragen bekommen, die wir zusammen mit Professor Dr. Heiko Koller sehr gerne beantworten würden und später auch eine rege Diskussion haben. Viel Spaß und wir hören und sehen uns später. Video ab.
Might improve your posterior cervical. Dear colleagues and friends, my name is Heiko Koller from Technical University of Munich, and it's a big pleasure to give you a deeper insight about the new screw rod system named Symphony. This might improve your posterior cervical surgeries. So excellent handicraft needs excellent tools. That is why Symphony might improve also your surgeries. So there are a lot of needs a surgeon has, and this system provides you improved fixation strength. This is actually what we need, particularly in the growing population of elderly people. So with the new system, you have diameters from 3.0 to 5.5. You have a dual lead, which is twice as fast as usual. You have a screw tip, which facilitates quick screw start. So this is very nice for quick insertion and for the first grip and feeling the first threads. And the threads are designed for specific bones. You can select from cortical fixed design, cortical and lateral mass screw design. So this is usually it's a large family which comes now to our OR and can improve our daily work. There's another need we surgeons have, and this includes versatility. So in the head rack you see in the past was about this. And now we have a more comfortable head rack. So the head stays where your position is, and you have a large lateral offset, and which should make the rod to screw fixation more easy in the daily work. And this is very important because co-aligning the rods and screws is an important clinical issue. So you see on the left side, there's a sagittal plane shown and a lordotic rod. So if you have to bend your rod in the coronal plane multiple times, it's very difficult to establish cervical lordosis. So I recommend to do an inline screw placement, and if this is not possible, the new system provides you with a lot of connectors, including offset connectors, lateral connectors, which allows you an inline rod placement and connection, and this eases also cervical lordosis construction. So there's a large family of connectors, including universal reduction type connectors, which is good at the cervical thoracic junction. Slim connectors, very important, and like also these top loading connectors, because then it's more easy to put these connectors between the screw heads during surgery. Sometimes it's quite narrow in the cervical spine. Articulating connectors are also very nice for the cervical thoracic junction. So connectors are important for co-aligning screws and rods. You see here some examples where it was very nice to have these connectors for crossing the junction to the cervical upper part, like the occiput, or to the upper thoracic part. And so you don't have to fiddle around with lots of rod bending. Connectors are also important to augment crossing constructs. As you see here, a patient had in the upper part, there was a connector placed, and then you can augment this upper part with a 3-rod construct, or you see here on the right side where first a congenital surgery has been done. Then we had to connect this down for the trocolumbar surgery, including the VCR, and so this was very nice to connect it. And we planned it in the first surgery to have it more easier during the last or second surgery. So there is a large family of screws, and these screws are surgeon tailored. That is, you have actually each screw design for any kind of pathology, including lateral mass, cervical pedicle screws, long head reduction screws. You see here the reduction sleeves. Then you have the standard C1 shank screws, or lateral mass screws also called. And of course, you can have these as reduction screws. And for a thoracic spine, you have also CFX thoracic pedicle screws and thoracic reduction screws. And importantly, for many users, you have cannulated standard and reduction screws. So cannulated screws are also available, and actually you can cross the cervical spine and the thoracic spine using one set and one brand. So this is quite comfortable thing. The large implant family we have now includes connectors, a multi-point fixation device, and a novel rod set. So it should be possible to treat any cervical pathology with one set. But how to use this and when to use which part of this is a big question. So one really big step forward was this multi-point fixation device, which was developed. It's good in rigid bone and rigid spines as a screw bone anchorage device. So the idea is behind that you can use it as an alternate for pedicle screws. And if there's a difficult anatomy or if there's a very subvertic anatomy, then these screws give you the characteristics of a strong bone anchor. I will show in more detail. That's how it's looking. You put your screws like lateral mass screws, and then you can add these two small bone screws, which are rigidly connected by this kind of washer system to your head. Then you really have a very strong, and this can be of particular importance when treating osteoporotic spines or making spinal correction surgery, deformity surgery in these patients. Then you can have a strong multi-point fixation locking in the cervical spine, and you can cantilever it down to the thoracic spine. And then it's really a good alternative to pedicles. There are many rods now with the new system, and there are titanium rods, cobalt chrome rods, 3.5, 4.0. There are transition rods from 3.5 and 4.0 to the larger rod diameters. So actually you can connect it to any system available. There are also set style rods, which is quite nice for revision surgeries, where you can convene the prior instrumentation of, for example, crossing from cervical to thoracic spine. And there are also hinged rods, which has a special indication in corrective surgery or in the cranial-cervical junction. So all types have a need. There are different rods for different pathologies. And actually to achieve advanced stability using 3 rods at the cervical junction in osteotomy cases or in significant destabilized spines, it makes sense to use transitional rods. And also you can use, of course, these bent set rods to make it more easier in some cases. You have to ask yourself whether you need high stability or it's more important to have a better bending feasibility. For example, when you have a long fusion, including the occiput and thoracic spine, it's quite nice to have a titanium rod. On the other hand, there are also issues when you have to decide between the titanium and the cobalt chrome material. I will have some comments on this later. And the hinge rods, as I told you, can be helpful in the craniocervical junction if there are problems with bending the rod and to prevent this kind of tenting here, that there is a large tent, which is not good for the soft tissues at the craniocervical junction. And actually the rod biomechanics can matter. So you have to understand a little bit what kind of material you're using. So in regards to rigidity, this makes an issue, makes a consequence when it's coming up to the maintenance of the bend rod shape after implantation. And the stiffness of a rod gives you some information about the magnitude of the recoil forces that act upon the screw bone interfaces. So stiffness and rigidity are characteristics that impact the behavior of your rods and your correction you're doing. And you see here biomechanical data of Symphony. And that's very interesting. You see here a 3.5 millimeter cobalt chrome rod with a double increased yield strength, stiffness in comparison to titanium rod. On the other hand, the 4.0 titanium rod is not far away from the cobalt chrome rod. So just changing the material can increase your stiffness quite a lot, and this impacts the characteristics of correction. And I will show later what this is about. And you see here, when making a cantilever correction maneuver, so you insert the rod and you press down the rod, recoil forces do act on the bone and on the screw bone interface, and this can cause loosening. So on the one side, it's important to have strong screws and fixation, like the multi-point fixation device I told you. But on the other side, you must think by using which kind of material you want to apply and the related force. So alignment correction and correction forces is an issue, and this system provides you good tools for surgery. On the one side, there's a kerrison reducer, which can really give you a strong fixation to the screw and a good reduction characteristics. There's also a reducer rocker fork, which is for daily work a very useful tool. And once again, you have to decide how flexible is the spine and how rigid is it, because if it's very rigid and you pull with this kerrison reducer, then you can also strip the screw out of the bone, and so careful. Long head reduction screws is a very big benefit and new feature of this system. And using these screws in the wise way, you can lower the recoil forces I've shown you here on the left side, and there are numbers 1, 2, 3. So if you have the sequential order of fixation of the rod in the screw head, you can also protect your correction screw here, number 2. Then you lock it. And then finally you lock the last screw, number 3, or number 4, or number 5. And you can distribute the correction forces harmoniously among the spinal levels and prevent screw pull up. These cantilever correction maneuvers are also working in the craniocervical junction, and using these long head reduction screws can be helpful and protective for the screw fixation characteristics in the bone. So again, this enables you a more harmonious force distribution over multiple levels. The long head reduction screws, they are also good if you have to treat combined kyphosis and scoliosis. And particularly when you have a long construct, for example, also in degenerative spines, easily by rod bending maneuvers, you can convert a scoliosis into a more, or a kyphoscoliosis into a more lordotic spine. And these long head reduction screws, they allow you more play inside the screw head. This eases the correction process and causes less stress. Regarding subtle alignment correction, the Symphony provides you a lot of tools. In combination, for example, with hyperlordotic cages, it's more easy to achieve a nice and harmonious lordotic correction, as you see here in this example with an anterior release, increasing the height, putting this lordotic cage inside, and then locking it down using these long head reduction screws. It's very straightforward and easy to achieve when using tools. Advancing construct stability is another important feature, which is possible with Symphony. And we know from the thoracolumbar spine that outrigger rods crossing particular substructional osteotomies or crossing 3 columnar osteotomies are quite helpful to prevent failure and to achieve fusion. And the same is true in the cervical spine. So in the cervical spine or cervical thoracic spine, using outrigger rods or satellite rods, as you see it here, they improve the stability at the zone of destabilization. Can also be a tumor situation or large decompression. And now there is a large connector family which helps you to facilitate aligning this construct. However, there's also other construct, more recent technique, which is called the 6-screw 3-rod construct. And this includes placing 3 screws in the upper level and 3 screws in the lower level or at the end level. And with this kind of a construct, you achieve, or you can boost your construct stability, not only crossing the osteotomy side, but the whole construct stability from upper level to lowest instrumented. And actually, we made a nice study, and Dr. Hartmann from Innsbruck, he was head of this study, and we achieved very interesting results comparing posterior standard instrumentation, posterior standard and 2 outrigger rods, and 6-screw 3-rod instrumentation. So you see the clinical examples here, and it was a very nice biomechanical study we did and got a lot of interesting results. And finally, this 6-screw 3-rod construct outperformed all other posterior constructs. Of course, the 360 construct with an anterior blade, as well as the 6-screw 3-rod construct, were shown to be still the biomechanical benchmarks. So summarizing this large study in a few slides, I can stress that this using the outrigger rod increases the stiffness at the zone of instability, and the 6-screw 3-rod construct, it increases the stiffness of the total construct instrumented or bridged. We also found in the study, and we could confirm that the 360 is the golden standard, and however, the posterior only 6-screw 3-rod construct, particularly multi-level reconstructions, outperformed all other posterior constructs in all motion directions. So this was very interesting to see, and I think this is a new standard of reference for advanced construct stability in posterior only screw rod construct. Later, why is this like this? So clinical implications. Finally, as you see here, there are some patients where it's very difficult these days because of the screw crowding over here and a big deformity surgery to put connectors. So in these patients can be helpful to have the 6-screw 3-rod construct. On the other hand, there are more standard deformity surgeries where it's possible to have, or where it makes sense to have the osteotomy zone being crossed by a third rod called the outrigger rod. So this makes the destabilized zone more resistant to failure, while the 6-screw 3-rod construct boosters the total construct covered by the 6-screw 3-rod instrumentation. So as shown here in clinical cases, this principle, it works in the craniocervical junction, in revision surgeries, in crossing the cervical spine, in primary deformity surgeries, and this is something I can recommend as a safe technique. Of course, needs some learning, but this is makes sense to explore. What about crosslinks? Also in the sub-analysis of this study, we could show that the crosslinks, of course, make sense to increase axial rotation testing, particularly in 2 and 3 level corpectomies. And 1 level or 2 level corpectomies, it was close to significance, but actually in a 3 level construct, this makes sense. However, using more than one crosslink doesn't make sense so much, and all the other prior studies have shown this. And what is very important, if you have risk for or if you imagine that there might be a screw pull out and screw losing over time, a crosslink can create a rigid spinal anchor, a force link in the challenged proximal distal foundations. So then you have the characteristic of a very rigid anchor in the cervical spine, also using lateral mass screws. And these situations might also make sense to use a crosslink. There are specific indications, including fusion to the occiput. And of course, with Symphony, there are the established quality characteristics for fusion as before. However, it advances this palette of instruments, and particularly after occiput decompression, it's useful to use this kind of implants Symphony provides, and in the standard instrumentations, it's useful to use this hinged rods or to have this kind of 3.5 cobalt chrome rods or 4.0 titanium rods to have a strong fixation at this level. And of course, you have to take a bone, otherwise it doesn't. Pediatric solutions are given by Symphony, and I've shown you one of the instruments there, but what is very important that there is a 3.0 diameter screw. So in these patients with very difficult anatomy and young patients, small anatomy, it's useful to have an adaptation of the implant. And also in some of these patients with very difficult anatomy, it's useful to have navigation instruments, and these new instruments, they increase the range of freedom during the navigated screw tug preparation. And this actually is a basis for posterior cervical MIS solutions that we're working on. Fixation and reduction, the craniocervical junction. I want to stress that we have this kind of nice reduction screws now with Symphony. C1 lateral mass screw is a working horse, and using this navigation tools or without, you can have very accurate placement of screws. This is very important because we know that the anatomy is not looking like here on the right side, but rather looking like this, and that is a venous plexus, which can be a pain in the neck during surgeries. And some of the surgeons propose to cut the nerve root in all cases to get access to it. But I think that it's necessary, and with using this new C1 drill guide, which is provided as part of the Symphony instrumentation, we have a more easy insertion technique. You see here on the right with the customized prior instrument, placing the trocar on the C1 lateral mass is easy with the section along more close to the bone, and then you drill the pilot hole, insert a screw to suit about 2/3. Then you remove the trocar and you do final tightening of the screw. And this is all being done without fiddling around the venous plexus at C1, C2. So this C1 drill guide will improve quality and accuracy during these surgeries and make it easy. The other thing is having a 3-millimeter screw. It might be more feasible to do C1 arch screws, as you see it here in the patient shown. It's possible if the C1 arch has a cancellous core, and using this smaller screws, this might be more easy without fracturing or breaching the C1 arch, particularly in the upper direction. The reduction screws, as I told before, they will help the reduction process. The long valves over here makes it more easy, and without large forces and with harmonious distribution of forces to achieve full reduction in C1, C2 deformities. There's one technique I really like also, and this is the hinged rod technique for Jefferson burst fractures and applying a C1 ring osteocentesis. As you see here, you can have a Jefferson burst fracture, 3 or 4 apart, and you can apply the hinged rod as you see here. And then you put on the trocars left and right side, and then you make a monoaxial current connection or just a locking of the rod to the C1 lateral mass screw on both sides. Then you make this destruction over here, and then the anterior ring closures, and then you fix the hinged rod, remove the valves, then you have a very nice anterior compression, which is very difficult with all other techniques applied in the past. So this kind of surgical tip might be helpful during your. I thank you very much for your time, and I hope you enjoy working with Symphony in the future. And if there are any questions, please feel free to contact me by email or directly, and then we can exchange more thoughts on cervical pathologies. Thank you very much.
If there are any questions, please feel free to ask and to log in. So I think there are currently no questions coming in. So
Keine Fragen, Herr Professor?
denke nicht, und dann denke ich, können wir komplettieren.
Okay, dann bedanke ich mich im Namen von DePuy Synthes bei Ihnen, Herr Professor Koller, für Ihre Zeit, für den Vortrag und wünsche noch allen Teilnehmern einen schönen Abend und einen schönen Rest des Kongresses.
Gleichfalls, alles Gute.
Alles Gute. Tschüss.
Wiederhören. Tschüss.